Past 4 years, when I first came here, I could barely hardly walk. Barely hardly walk. Barely hardly walk. Barely hardly walk. Barely hardly walk.
Hello, I'm Roberto Cancel, and I'm here at Advanced Pain and Wellness in Jersey City, New Jersey. I'm sitting with Dr. Priti Shinde. She's a doctor in physical therapy, and she's going to tell us a little bit about her experience here. Hi, Dr. Priti.
Hello, Alberto.
Tell us, what inspired you to become a physical therapist?
It's because of my dad. My dad needed physical therapy back in India, and we had a handful of good physical therapists back then. We had to travel quite a few miles in order to get his treatment. That's when my mom decided that her daughter, that's me, is going to become a physical therapist in future. And I loved going there with my dad, watching physical therapists do little movements to make him feel better. So that's my
Fantastic.
story.
Yeah. Can you tell us about your professional journey, your education, training, or early experiences?
Yes, I'm a physical therapist for last 13 years. I did my Bachelor of Physical Therapy in India. Followed by that, I started my own physical therapy center. When I was doing that, I understood that I need to have a little bit of administration background in order to run the business and be a good clinician. That's when I enrolled myself into MBA in Health and Hospital Administration. While doing my practice in India, I felt like I should try understanding what happens in Western world and learn more and more about physical therapy, manual therapy skills and knowledge.
Great.
That's when I came to America to
Mhm.
do my Doctor of Physical Therapy. And soon after, I fell in love with America and I decided to pursue my career here. And here I am now.
Great, great. We're happy to have you. My understanding is that you work with runners,
Mhm.
and what's your advice on how they can prevent injuries?
Uh, I would like to give some advice to our especially recreational runners. I would always tell them to come and do the running analysis if they can, because that will give them a better understanding of how and where their body mechanics is working a little wrong or how they can improve it. The second advice for them would be don't dive into running directly for 10 miles or set bigger goals. I would highly encourage them to start with a smaller miles, with a smaller pace, get used to the running pace and whole running mechanics, and then slowly and gradually increase their distance as well as their pace. The third and most important advice would be do not neglect to do your warm up and proper stretch cool
Mm,
down exercises. So make sure that before running you do a good 10 to 15 minutes of warm up activities, and after you're done running you are doing either foam roll as your cool down exercise or at least some stretches in order to make sure that you are not putting your body into some quick shock.
great, great. Yeah, so tell me, are there new techniques or tools, technologies that you're excited about?
Oh, yes. Over here, I would say that we do laser for our patients for pain management.
Mm,
Along with that, there are different techniques, evidence based techniques, we call them, that we try to perform on our patients. That includes myofascial release techniques, Graston techniques. We also do lots of joint mobilization techniques. There are different ways of doing joint mobilizations, like I am specialized into Mulligan techniques. So I do that on my patients in order to improve their range of motions and also to make sure that they get their functional activities back. Along with that, I do vestibular rehab and TMJ, which is temporomandibular joint related disorders. So we do special therapy for them, but you will see not a lot of therapists around this area are specialized in.
Great, great. And we have it all in this one office, right?
Yes, we do.
Fantastic, fantastic. Tell me, what simple daily habits can help people to improve mobility and prevent injury?
This is like one thing what I tell all my patients to do. Just walk around. Nothing else. Every 1 hour, make sure you get up from your chair, even if you're watching TV, just walk around, and you can just do like some stretches too.
Fantastic. When should someone seek physical therapy instead of just waiting it out?
Anyone who has chronic pain, any new acute pain, if you feel like my back hurts even after walking half an hour, probably this is the right time for you to come and see us.
Mm, fantastic. And lastly, can you share a memorable experience where your treatment made a significant difference?
Yeah, sure. There are many, but I would definitely like to tell you one of that story where one patient who walked into our office, he was even unable to walk properly, get up from his bed. He used to feel dizzy all the time. He had one of the conditions called as BPPV from vestibular system, and he had been brought over here with help of his wife, who was elderly too. Looking at him, we felt really bad, and we knew what we are supposed to do under vestibular rehab. And I'm very happy to say over the period of next 3 months physical therapy of 3 times per week, my patient felt so better at the end of therapy that he got back to his previous functional levels.
Fantastic. Well,
Thank you.
thank you very much, Dr. Priti, for meeting with us. Again, I'm here at Advanced Pain and Wellness in Jersey City, New Jersey. If you're suffering from any chronic or acute pain and need a great physical therapist, please come visit Dr. Priti.